Hey guys, and welcome back to another episode of XO Medical Spa. Today we'll talk about PDO Threads. A little update on my house search. Didn't get the home, unfortunately. We were pretty close. We were in closing, we were in escrow, and then at the end of the time, the seller backed out. So we'll continue our search this weekend, probably a couple more open houses, and then hopefully put in a couple more offers as well. As you can see, it is casual Friday or casual Saturday to get today again for me. So please excuse me for not being in scrubs, but let's keep it nice and relaxed. Today, let's talk about PDO Threads, everyone's favorite subject. But today we're gonna focus in on other places you can use to treat it and how do we use it in conjunction with our other products such as Botox and fillers when we come back. The reason I'm going to speak about PDO Threads today, because one of my clients today, we actually treated her with PDO Threads in the frown area. And then during the course of this week, because I had a couple trainings, one of the questions that during the trainings they asked me is, who's a candidate for PDO Threads? And to answer that question, almost everyone is a candidate for PDO Threads. When you come in office, we'll talk about those reasons and then who and who can't be. But one of the common misconceptions is if you're too old, if your skin is too thin, then you may not qualify for PDO Threads, which is true and false. If your skin is too thin, we run the risk of seeing the PDO Threads when we place it. But we can adapt to that. We can either use thinner threads or we can just skip the lifting part. And that's usually where people see those lumps or bumps, or if you have very thin skin, you can see the threads through the thinning of the skin. But if you have a thin skin, likely you can't tolerate a lot of fillers either, because if you put a bunch of fillers into a patient with very thin skin, then you run the risk of seeing the fillers, the bumps of the fillers. So what we can do with PDO Threads is not just lift, but how do we improve skin quality? This is where laxity comes in, this is where collagen comes in. And if you've ever done PDO Threads or if you've even listened to me speak about PDO Threads in the past, yes, I wanna lift your skin, but more importantly, the reason I put in so many different threads, the reason I put in so many threads is I wanna improve your skin quality. So when those threads disappear or dissolve over the next 4 to 6 months, your results last 1.5 to 2 years, and your skin quality improves over that time frame as well. So I'll pull up a couple photos, but you can see in a couple of these photos, as this patient progresses over the next 1 to 6 months, their skin gets better, better, and better. It gets thicker, the crepiness is less, the wrinkles are less, and you can see the quality of the skin thickening as well. So if you come into the practice and you're over the age of 60, or if you're younger, but you have very poor skin quality, such as you've been sunbathing your whole life, you're a smoker, anything that degrades your skin, that thinning of the skin amplifies the aging process. So if I do the treatment right, and if I put in enough threads into the area, such as this cheek area, this preauricular submalar area, if your skin is very thin here, every time you smile, it crinkles and the laxity falls. So I want to build all this good tissue over the next 4 to 6 months, and you'll see it in these photos right here. Continuously improve it, continuously improve it. If I get to the point where your skin is very, very good and a little healthier and thicker, then at that point we can discuss lifting with the threads as well. But let's just say you couldn't do fillers either because it was so thin. Why not thicken up the skin, get to a good place, and then eventually do some fillers as well? So that is one alternative way where we can treat patients who think they can't be treated with PDO Threads, and one of the ways where we can improve skin quality in a patient with PDO Threads. Now, the second way we can treat PDO Threads is with the patient I saw this morning. She has a very aggressive frown. She's consistent with her Botox. She's consistent with her Dysport, but no matter what, if you've ingrained this line over the last couple decades, no amount of Dysport or Botox will likely correct it. Now, what Botox and Dysport does is it keeps it from getting worse. So if I can minimize your ability to frown, then you're not making that wrinkle deeper. But what we can do with PDO Threads is treat it like a pseudo filler and then also improve skin quality, which we just mentioned. So this line that we etch in over and over and over, some places will take filler and fill it. I personally don't fill this area because it's a pretty dangerous area to fill, where we have some important veins and arteries running right through this tract right here. So I personally don't fill this area. But what we can do is take PDO threads, and in this instance, we use our twists and we use our smooths to help push out those wrinkles, but then also improve the skin quality in this area. Because by etching in this line, you're almost creating like a scar. You're creating the scar that's pulling down on your skin in this area. And that's why no matter how much Dysport you use, how much Botox you use, you will always see that line. So yes, Botox and Dysport every 3 months. But every time you see me for Botox and Dysport, what I do is I take little twists, which are smooth but coiled, and I lay them right into those wrinkles. This way I can safely fill this area without risk of arterial or venous occlusion. And I don't want to say no risk, but limit the risk compared to fillers. And then I can take some smooth threads and lay them across in this area to give it further structure. And those smooth threads, the analogy I use is, think of it as rebarb inside concrete. You're giving extra support, extra structure to that area. And that's how we can treat the glabellar lines, the frown lines. Every 3 months Botox, Dysport, every 3 months throw in threads as well. And that's another way that we can treat with PDO threads. And now the last patient I had today is, we use PDO threads for his under eyes. And a lot of these concepts or a lot of these Q&As that I come up with are just everyday patients. We all have the same concerns, we all have the same questions, but we don't know how to actually treat these areas. So with him, he came back a month after we did tear trough filler. So we filled the tear trough area and he came back and he's like, I'm still not exactly to where I want to be. So we talked about it. I said, yes, I can put in fillers, but the risk reward at this state for your eyes, I think there's more risk than there are rewards. So with the under eyes, you can imagine it's always the first place that we get swollen. Lose a night's sleep, we cry, we drink alcohol, we eat salty foods. This is the first place that shows it for us where we've had a long night. It's right under our eyes. It gets puffy, it gets swollen. Now, if you have fillers under there, it will amplify that effect because fillers, the makeup of them tends to pull in water. It's hydrophilic, it pulls in water. So if I added more filler to this area, you may look good today, you may look good tomorrow, but as that filler hydrates, as your day-to-day routine goes back to normal, say you have a really salty meal, say you're on a plane flight, say you go to an area with high humidity, you're gonna swell even more so than what you normally would. So that's what I mean, the risk reward. You may be happy in the moment, but in other circumstances, it might swell past the point of happiness. So what I mentioned was, let's take PDO threads. We Botox and Dysported his crow's feet to minimize the wrinkle. But it's also important that we minimize the movement in this area, because if I put PDO threads under the eyes, if I put PDO threads around the crow's feet, I'm trying to accomplish two things. One, I'm trying to reduce his crow's feet by putting PDO threads in that area. We talked about improvement of skin, improvement of wrinkles. But the PDO threads that I put under his eyes, what I'm trying to do is I'm trying to thicken the skin, improve the skin quality. The skin under our eyes is some of the thinnest skin we have on our body. So every time we smile, it pushes up against that thinning skin. And you can imagine a piece of paper, every time you crumple it, you're creating more wrinkles. Every time you crumple it, you're creating even more wrinkles. But if I can thicken the skin under the eyes to go from a thin piece of paper to a thicker piece of cardboard, then when we smile, it won't crumple as much. And then also, if we're thickening the skin, you may not see that hollowing as much as well. So that's another way we can use PDO threads in conjunction with our Botox and our fillers to get us to the point that we want to get, but also limit the side effects that may occur by overusing one singular treatment, such as fillers. All right, so that's another recap of PDO threads, everyone's favorite procedure. And I think when we see it online, when we see Google or other places that we research, we always think of it as the lifting. But that's what really distinguishes my practice from other practices and other providers. But yes, I am lifting your skin, but more importantly, I'm improving the skin quality, and that's my results typically last 1.5 to 2 years. And this is why our results here get better over time as the PDO threads dissolve. Second part of that is we're very creative and we come up with new ways to improve skin because we're trying to understand what is the cause. I don't want to just put Botox into you. I don't want to just put fillers into you. I want to teach you the causes of the things that we see. Why do we have hollowing? Why do we have these wrinkles around in this area? Why do I not continuously put fillers to try to treat that or continuously put Botox? Because there's the treatment of the cause and there's the treatment of the symptom. This is the symptom. If you just came in and you're like, can you just keep filling, you're gonna look unnatural and you're not gonna get to the result that you want. The cause is all this up here: aging process, volume loss, laxity. So when I choose PDO threads, when I choose fillers, it's to treat the cause. And in this instance, for these patients, the cause is the wrinkle. We're limiting the wrinkle, but now that we have this wrinkle in place, how do we fill it safely? How do we improve the skin quality in the area? Same thing here. The wrinkle is what you see, the hollowing of what you see, but it's the laxity, it's the thinning of the skin. So how do we thicken the skin? How do we improve skin quality? And that's where the foundation of our treatments comes from. It's really the education of why you're seeing what you're seeing and now choosing the right procedure to treat that problem. So I hope you like this, another episode of Exo Medical Spa and some of the clients that we had this morning. So leave a comment below, leave a question below. This is where we get all of our content and how we answer these common questions that you guys may have but don't know how to ask. And even if you're not coming into the practice, if you've had a provider give you a consult somewhere else and you want another consult, leave a comment below and ask us all these good questions. So make sure you give it a like, subscribe, and also share it to your other friends and family because they may have the same questions as you. I'll see you guys on another episode of Exo Medical Spa. Bye.